gives you your scenario, he's just going to give you a basic. And so then you're going to ask, well, you know, is he breathing? Is he, you know, obviously he's unconscious, and then you're going to start from there. So you always start with checking the pulse, checking his respirations, if he's even breathing. But you're not at the CPR level yet, so for the skill that we're doing, we're just gonna do it's rapid. So we'll start by palpating the scalp, and you're just feeling for deformities, and you're also feeling for fluids. So you'll start from the top, work your way to the back, and you're gonna check for if there's any blood, because he might have some hair, and you might not see it, because you might have dark hair. You're gonna work your way around the back. You're gonna palpate for any swelling, deformities, fluids.
So with this one, he did the halo test, right?
He told us about the halo test.
So you'll see that in his nose, in his ear. You guys know how to check that.
Yeah. Square it up, tap it, open it up, give it a medicine side.
Put it to the side. So then you're gonna move to the front. You're gonna palpate the arches here, the orbits, nasal bone. You're gonna work your way down to the mandible, and you're gonna palpate this area here is your mandibular symphysis. This is a very common area for if it's facial trauma. This is a very common rate. You're gonna open up his mouth and look to see if you have any fluids, any missing teeth, anything that's gonna obstruct his airway. So we're gonna come down, and after you've palpated his cervical, you'll move to the front, and we're gonna do your 310 slap. So you're gonna start with looking for tracheal deviation in JVD. You come down, you can look for a stoma. You know, he might have a cervical.
Really?
Tracheostomy.
If he is conscious, you ask him to open his mouth, and you feel right here, you feel your joint. When you open your mouth, you gotta make sure that's good.
And in the case of like him also missing teeth, like I pointed out earlier, you can ask him if they were always missing.
Bro, you're missing teeth or what?
Yeah. And you're gonna, so then the O is looking for any medical devices. Some people wear necklaces. Been told some people tattoo stuff. That's not a very good thing to go by. So yeah, look for bracelets and any type of anything that's gonna give you an indication to them having a medical condition. And then your splat is you're feeling for subcutaneous emphysema. You're gonna palpate the clavicle, and then now we're ready to put the seat collar. So never supposed to do that, by the way. Never walk over your patient. Right.
Why are you doing it?
So I'm telling them what not to do. So this is already measured. So do you guys know how to measure seat collar?
Yeah.
From
neck to shoulders.
You guys got that? From here to the shoulder?
Yeah.
Okay.
And then how do you measure it on there? That's where I can.
It's a black line.
Yeah, so you see this black line here?
Yeah.
So that's what you're gonna use. So depending on, 3, and then you match it up with the,
Okay. Okay.
you guys got that?
Yeah.
From the black line here, just how many fingers you'll mark it up. So you'll just move it up or down. So most of these mannequins, they do have small necks. So you might have to use a pediatric collar. And we do have some, so you just have to dig into the bin there.
If the patient is responsive, they complain about it, but you know it's like the right size for them. You adjust it with their.
If he's conscious and he knows.
If he's saying it hurts, you put it on right, it doesn't matter. You're
So
there
you
to help
can't
him,
change
you're
things?
not there to change.
Yeah, and I mean the backward alone it's uncomfortable. And so
At the time, that's.
Quit your bitch.
Deal with it.
yeah, you'll let them know in advance before you do anything. So you obviously got to let them know what you're doing. You always want to, you just don't run through it and just do stuff to a patient who, especially who's conscious, because not only do you want to let them know, especially if it's something like this, you know, hey, it's gonna be real uncomfortable. So I apologize, but it's necessary. You know, and I mean, little pains.
Tell them they can die. You don't have it, they'll shut up.
Yeah.
Up to and including this.
Yeah, that's a Richmond thing. He's just like, well, we can do this, or you can just never walk again, or you could possibly die. And they'll be like, But-
Yeah.
No, put
I'll
on
take
2
it.
if you would like.
Yeah. Okay. So then, so ask your partner to your head man to butterfly.
Butterfly, if you can't see,
Yeah.
you need to hold it good out. If you can't get it, the seat collar through the strap, just feed the strap first and then this one is a big extra business. So they're gonna be all weird about it.
So then, you're gonna want to double check if you can, and make sure that front, yeah. So now you're gonna continue your assessment. So you're gonna work down to the shoulders. You're feeling for swelling and looking for instability. If he has any kind of shoulder injury, you're gonna see it. You're gonna see it. So you're gonna offset. Check his Ocranon.
What's it called again?
Ocranon. Yeah, it took us a while. Or Cranon.
I just remember it because it sounds like a transformer. So that's how I remember it. So,
Right.
No, you asked us that one, man.
Yeah, well, I have no idea.
He's like, oh.
Venus.
Offset. You can do the same on the opposite side. Offset. Check this out, offset. Now you can go ahead and he's unconscious, so you're gonna want to check circulation. So you can do a cap refill. You're gonna check to see if the pulses are equal bilaterally. How much do you got for that? If he is conscious, you can ask him to wiggle his fingers. Without him seeing, you can actually grab a finger one at a time and ask him if he feels that. And so you'd be able to check for motor and sensory. So at this point, he's unconscious. You can only do 2. So you're gonna want to barrel hoop him. You're looking for a flailed chest, seeing any kind of movement in his chest. There shouldn't be.
What's a flail chest?
That's when you have 2 or 3 consecutive breaks in the ribs. So
Okay.
itself's gonna cause problems breathing.
You'll feel like a hole. It feels like your ribs are going like this.
Oh.
If they're unconscious, can lift up their shirt and do that.
Yeah.
You're probably gonna cut off
cut
Yeah.
off the shirt.
For the case of the mannequins, we kind of like try to. I mean, you guys will be able to cut shit off them in other skills, but yeah, it's as much as you can expose would be great, because then you'd be able to see bleeding and bruising and you'd also be able to see that. Yeah. So now you're gonna do your Dr. Germ, which is what.
Distinction, region.
Wait, what is it? Retention? Rigidity?
Rigid.
What is rigidity?
It feels rigid.
It feels rigid, like it just doesn't feel right, almost kind of like a deformity.
Hard.
Hard?
Yeah,
Oh.
like if they swallow the rock.
Yeah, and with that, you'll guys, as you guys go on, you'll learn which organs would be rigid,
Okay.
and like your hollow and your solid organs are both gonna react different. So you'll learn what to palpate for.
Okay.
So you got
Extension and rigidity.
Distension, rigidity, this is where I get lost.
The germ, I don't know the germ.
you got guarding.
Oh.
So if he's conscious, you'll see him. Just yeah.
And ecchymosis is the E.
Uh-huh.
Oh, this one's bruising, but it's like ecchymosis.
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 And the most important, which you'll see.
Respiration?
It's another E.
It's another E.
Oh.
Edema? No.
Edemas of fluid.
You'll be checking for that in other bases.
You'll see it is out.
Expiration? No.
No. You have to start with an E.
Yeah. It'll also be one of your skills later on too. It's
Nothing.
eviscerations. That's when you have a part of the your intestines coming out. Any part of those organs just coming out through the skin.
Oh, like cut or from
Can't miss
stab.
that.
Yeah.
Right.
All right. So you got E. The other
The
arm.
germ part,
The other arm?
You said it yesterday.
I said it yesterday?
Yeah. When we were running through this. And we used appendicitis as its
Ruptures.
no.
Yeah, appendicitis would be actually a good
Rebound?
Yes.
rebound.
Rebound tenderness.
Rebound tenderness.
All when they get hurt after, like after you pull away.
Yeah.
Yeah.
Okay, that'd be good.
And that would be like a good sign of appendicitis.
Okay, and then N would be mass, right?
Right. So most importantly, if you feel any pulsating masses in the abdomen, that is immediately a load and go. And anything pulsing, that's normally indicative of a AAA, which is an abdominal aortic aneurysm.
Oh, okay.
That means he has minutes. You know, because I mean that's something we can't do in the field.
Yeah.
And he has to get taken to a trauma center.
Okay.
So he's unconscious. So you just palpate the 4 quadrants, just feeling for your Dr. Germ, and you're gonna want to have all this exposed, just so that you can see.
You can see what you're doing.
And so as far as ecchymosis goes, it's only found in 2 places: the abdomen and the face.
Okay.
So as you run through this, you're gonna just do a quick little sweep, and for
Proprietism.
Yeah. and which is an indication of spinal injury. You're gonna barrel hoop.
Or he's just excited to see you.
Yeah, if he's really starting to already have
You
to
can,
see
if
it.
he's conscious, you can ask him. And females too. Don't forget to check females.
Don't.
Because nowadays,
Girls have dingling.
Don't assume just
Don't
because it
assume
has
it's
long
gender.
hair and lipstick
boobs.
and boobs that
even
it's
if it's an unconscious female,
This is in Thailand.
yeah. I mean,
No, boo, this
if,
is California.
if you're working
This is
in
California.
Hollywood,
Yeah.
yeah, it's
You don't know who you're working with sometimes.
when you're doing the pregnancy, you don't need to be so obvious. You can come down to the knee one time and make it look like you're just going over to
Yeah.
the
Yeah,
other side of the
for
knee.
your when you check the pelvis.
so you're barrel hooping, coming down to the femoral, and you're gonna do your offset. You're gonna check to see if the patella is there. If it's not, look for it. If it's not, then you're gonna have to ask Rich. Well, doesn't have patella. Was it always there?
Is it always there?
And you'd be like, you could have someone who has
Prosthetic leg.
exactly
Prosthetic amputee.
offset, check for the patella, offset. Then you're gonna run through your PMSCs. So you're gonna check cap refill. You're gonna check for your pulses bilaterally. If he's a conscious patient, then you would do the same. You know, grabbing what toe? Can you feel this? Can you wiggle them? You know,
Gas pedal.
there you go.